Why do I sometimes black out? Blackouts are temporary losses of consciousness or fainting or memory that can stem from various causes, including low blood sugar or dehydration, medical conditions like heart disease or seizures, certain medications, severe stress or pain, and heavy alcohol consumption. A blackout due to fainting is medically known as syncope, while memory loss from alcohol is specifically alcohol-induced blackouts. Because the causes can range from minor to serious, you should consult a doctor to determine the underlying reason for your blackouts and receive proper diagnosis and treatment. Blacking out or losing consciousness temporarily can be a sterling experience. There are several reasons why someone might black out, ranging from minor and easily treatable causes to more serious underlying conditions. Here are some of the most common reasons: vasovagal syncope or common fainting. This is the most frequent cause of fainting. It happens when your body overreacts to certain triggers, such as the sight of blood, extreme emotional distress, prolonged standing, or even straining during a bowel movement. This overreaction leads to a sudden drop in heart rate and blood pressure, reducing blood flow to the brain. Symptoms often include dizziness or lightheadedness, nausea, feeling warm or cold and clammy, blurred vision or tunnel vision, pale skin. Orthostatic hypotension. This occurs when your blood pressure drops suddenly upon standing up. Gravity pulls blood to your legs, and if your body does not compensate quickly enough by constricting blood vessels and increasing heart rate, less blood reaches your brain. Common causes include dehydration, certain medications, example for high blood pressure, diuretics, medical conditions like diabetes or Parkinson's disease, prolonged bed rest. Dehydration. Not drinking enough fluids can lead to a decrease in blood volume, which in turn lowers blood pressure and reduces blood flow to the brain, causing dizziness or fainting. Low blood sugar or hypoglycemia. If your blood sugar levels drop too low, your brain does not get enough glucose, its primary energy source, to function properly. This is particularly common in people with diabetes who take insulin or certain oral medications, but it can also happen in non-diabetics. Symptoms can include dizziness or shakiness, confusion, sweating, irritability, heart palpitations. Heart problems. Various heart conditions can disrupt the normal flow of blood to the brain. Examples include arrhythmias, irregular heart rhythms, too fast, too slow, or erratic, can impair the heart's ability to pump blood effectively. Structural heart disease. Problems with heart valves or the heart muscle can reduce cardiac output. Aortic stenosis. Narrowing of the aortic valve can restrict blood flow out of the heart. Seizures. While often associated with convulsions, some seizures can manifest as a brief loss of consciousness without dramatic physical movements. These are sometimes called absence seizures or complex partial seizures. Neurological conditions. Less commonly, certain neurological issues can cause blackouts. Examples include stroke or transient ischemic attack, a mini stroke that temporarily blocks blood flow to part of the brain. Migraines. Some severe migraines can be accompanied by fainting or altered consciousness. Hyperventilation. Rapid, deep breathing can disrupt the balance of oxygen and carbon dioxide in your blood, leading to lightheadedness and sometimes fainting. This is often associated with anxiety or panic attacks. Medications. Many medications can have side effects that include dizziness or fainting. This often include drugs for blood pressure, antidepressants, sedatives, and pain medications. When to see a doctor. It is important to consult a doctor if you experience blackouts, especially if they occur frequently or without a clear trigger. You have a known heart condition or other serious medical conditions. You injure yourself during a blackout. They are accompanied by chest pain, palpitations, or shortness of breath. You have new or worsening neurological symptoms. A doctor can help determine the cause through a thorough medical history, physical examination, and potentially tests like an EKG, blood test, tilt table test, and or neurological evaluations. If you are experiencing blackouts, I highly recommend seeking medical advice to get a proper diagnosis and treatment.